And welcome back to Face the Nation. And now on to the other big story we're covering this week, the rising number of measles cases in the United States. According to state and local health agencies, there are now more than 150 cases reported in 16 states in this latest outbreak. Dr. Anthony Fauci is the head of infectious diseases at the National Institutes of Health. Our own CBS News chief medical correspondent, of course, is Dr. Jon LaPook, and he is in New York. Dr. Fauci, are we on the verge of a major epidemic here?
Not a major epidemic in the sense of globally over the United States, because more than 90% of the people in the United States are vaccinated. What we're talking about are outbreaks among vulnerable people. And I think what people don't fully appreciate is that children, even normal children without any issues of health, from birth to 1 year old, are not vaccinated, because you don't vaccinate children until they're 12 months old. So when you have outbreaks, children, for example, in daycare centers like we saw in Chicago, become vulnerable if there's enough infection in the country to allow for these outbreaks that we saw in California and Disneyland. That's the threat.
Yeah, it was California, the original group in Disneyland. We have this outbreak in Chicago. Any other pockets?
Yeah, there are, as you said, several states. There was in South Dakota, for example, there have been a cluster. And the vulnerability is always, since this is such a highly contagious infection, that someone can get exposed in a place where there's an outbreak and then travel at any part of the country and then get involved in getting sick, not knowing it, and infecting other vulnerable people. Not only infants and children less than one, but people who can't get vaccinated, like children with leukemia and people who have immunosuppressed states that they can't get vaccinated, which makes them much more susceptible.
Dr. LaPook, what do you say to patients when they come to you and say, should my child get a vaccination? I've heard all this stuff. I've read this stuff that's on the internet. We all know that this study that really sort of started all this turns out to be totally fraudulent. But what do you say to parents?
Well, of course, I advise that they get vaccination, but if there's some pushback, the very first thing I do is try to be sort of gentle, not make them defensive. And I say to them, look, I understand that if you have a fear, it's because you're trying to protect your kids, and that's your job as a parent, to keep your kids safe. But I point out logically that this all started with an article in 1998 that turned out to be completely inaccurate and was retracted 12 years later by The Lancet. The problem, as you point out, was the mischief was already done. So for 12 years, this was out there in the ether, the sense that vaccination was somehow unsafe. So I can try to be as logical as I can and point out why the benefits of vaccination far outweigh the risks. But still, when something's out there in the ether, there's this sort of almost Pavlovian conditioned response of they hear the word vaccination, they think, oh, dangerous.
Were you surprised that somehow it popped up as kind of an issue here, an early issue? My guess is it's going to kind of go away as a political issue with some of the blowback to some of the politicians that raised this, but I was a little surprised at that.
Well, you know, I'm never surprised when any of these issues become politicized. We saw that with Ebola for sure. And, you know, you look at states like Mississippi and West Virginia where they have mandatory, there's no exemptions except for medical exemptions for vaccination. They haven't had a case of measles in Mississippi since 1992. So you understand why, on the one hand, some people want to have the sense of personal control and freedom. But on the other hand, we have the issue of protecting society. I mean, there are things like drunk driving, for example. We don't allow people to go out there and just say, look, I want to go out there and get loaded, get drunk, and drive my car. We don't allow that.
Mm-hmm. Dr. Fauci, how can the government do a better job on educating people on that?
Well, by getting the message out as much as we possibly can. For example, our Centers for Disease Control and Prevention, the CDC, has put out health alert networks, and they're constantly trying to get the message across. They're doing a very good job, but you know, sometimes as much as you talk, you don't turn people around, but you shouldn't give up. But also, it isn't just people who have deep philosophical problems with vaccination. There are some people who, for reasons that are not as deeply philosophical as that you can get to and turn them around. And that's what I think the CDC is doing, and doing a very good job. But they also work very closely with the local and state health authorities. So it's that synergy and that collaboration between the federal government in the form of the CDC and the FDA and the NIH and the local and state health authorities, hopefully to get the message.
Should children who have not been vaccinated be allowed to go to public schools?
Well, again, that's not for us to decide. That is a local and state thing. What we can do is just what Jon said, is that get the information about you have a very good vaccine, you have a highly contagious disease, and you have a disease that's entirely preventable. When you look at that data with a safe vaccine, the conclusion is really almost obvious.
Dr. Fauci, Dr. LaPook, thank you both. And we'll be back with our panel to do some analysis on all of this in a minute.